Hello and welcome to the Knorr Simulation Lab at California State University, Fresno. My name's Marie Gilbert and I'm the Simulation Coordinator. The Knorr Simulation Lab has three main rooms: the main lab area containing 4 bed spaces, the control room and the debrief room, and is equipped with state-of-the-art mannequins and audiovisual equipment. We have adult, child and baby mannequins. This allows us to provide a wide range of simulated clinical experiences for our students. The mannequins are amongst the most advanced available. They can talk, cry and cough. They blink and their chests move as they breathe. Built-in equipment allows students to listen to authentic heart, breath and bowel sounds. They even have pulses which can be felt. Audiovisual equipment includes overhead cameras and microphones at each bed space and a large screen TV in the debrief room for viewing live video from the lab. We have the ability to record and playback video of the students during their simulation experience. Once a simulation has been developed, the lab is set up to provide environmental and psychological realism. The mannequin is prepared to resemble the patient in the scenario. This may include the use of wigs and makeup, together with any appropriate medical prompts, such as patient wristbands and medical notes. Typically, 2 or 3 students will be directly involved with each simulation. They receive a report from the facilitator and then begin to provide care for the patient as if they were in the clinical environment. The simulation lab allows the students to integrate the theory they've covered in the classroom with the clinical skills they've learned in the Nursing Resource Center. The simulation lab provides a safe environment in which students can develop their clinical skills. It exposes students to clinical situations they will encounter during their nursing career and allows them to make clinical decisions about patient care. The mannequin's response is directly related to the student's interventions, just as in the clinical environment. Sometimes the mannequin improves, other times it doesn't. During the simulation, the students not directly involved with the scenario watch the live video in the debrief room. This provides a different perspective and promotes good discussion during the simulation debrief.
And now that he's reassessing, probably we should be hearing no wheezing, right? No.
The computers that control the mannequins and the AV equipment are managed from the control room. The mannequins are manipulated so they respond appropriately to the students' actions. Some of the variables that can be adjusted include heart rate, respiration rate, and breath sounds. There are 2 types of voices that originate in the control room. One is the voice of the mannequin, which is used to respond to the students' questions, and the other is an overhead voice that is used to provide additional information to the students. For example, providing lab results.
No, it feels much better, thank you.
Excellent. You let me know if it comes back again and we can give you the same thing, okay?
Okay.
All right.
A debriefing session follows each simulation. During the debriefing, we have the ability to play back video recorded during the scenario so that students can observe themselves in action. Students reflect on their experiences, either as an observer or participant, and identify things that went well and things that they would do differently if they experienced a similar situation again. Simulation provides experiential learning without putting the patients at risk. The safe environment allows students the freedom to make mistakes without serious consequences. By providing our nursing students with this learning experience, we are able to develop their confidence, clinical reasoning, and problem-solving skills. These abilities will equip them to provide high-quality patient care as they move through our program and into their nursing career.